chant around. Oh, okay. Good morning, everybody. It's wonderful to be outdoors in Western Sydney to make some very important announcements today. Firstly, New South Wales, we've hit 82.2% of first doses, which is outstanding, and 52.7% of second doses. And of course, once we get to that 70% double dose number, we'll be able to enjoy all those things we've missed for far too long. Pleasingly, for 12 to 15-year-olds, we know that now 20% of 12 to 15-year-olds have had their first dose of the vaccine. Now, given that was only made available about a week ago, that is an outstanding result, and we're urging all parents to consider vaccinating their 12 to 15-year-olds. We want to make sure that when school goes back, not only do we have great coverage in the adult population of vaccination, but also in that 12 to 15-year-old group, which is so critical. Today, I also want to say that although we can't read too much into this, pleasingly New South Wales has 935 cases of community transmission, but unfortunately 4 people lost their lives, and we extend our deepest condolences to those to the families and loved ones of those 4 deceased. And I should note that even if case numbers go down, we should expect, unfortunately, that the number of people in intensive care and the number of people who lose their lives to go up, because as we've said consistently, because we've had a number of cases in the last few weeks, people ordinarily get very sick in the second week of the illness and sometimes stay very sick for a long time. And that's why we need to continue to brace ourselves for October being the worst month for the number of people who pass away and the number of people who need intensive care. And we should never lose sight of that, no matter what else is happening in terms of the vaccination rate or anything else. That is the likely scenario in October. So we can't be complacent, because we know that, unfortunately, given what Delta does, if we're too complacent too early, things can get out of control, and that's the last thing we want. We're all working together to get to that 70% double dose vaccination, and we should all keep working together and not take it easy, not be complacent, because we know what the consequences of that can be. Today I wanted to take the opportunity, as I'm joined by so many of our parliamentary colleagues, to say thank you to the Treasurer and Treasury for managing to obtain $11 billion for 49% sale of WestConnex. This is an outstanding result in very difficult circumstances, and will go towards supporting New South Wales recover and, of course, supporting our major infrastructure pipeline. And today I'm also pleased to announce, in the presence of all of my parliamentary and ministerial colleagues, that $5 billion of that will go towards a West Invest Fund to support local communities in Western Sydney in local infrastructure. And it's a very pleasing day all round. It also augurs well for our economic recovery, as well as our recovery coming out of lockdown. So New South Wales has been through a difficult time, and living with COVID and finding the right balance is always going to be a challenge. But we're definitely looking into the future with hope and optimism, and I know that many of my parliamentary colleagues right across the chamber will be so pleased with what this means for local communities and what this means for our future, given the difficult time that we've had. So Dr. Chant will now give the health update. Treasurer Perrottet will give an update on the wonderful news today, as well as the new fund, and Minister Ayres, who's the Minister for Western Sydney, will say a few words, and then we'll take any of your questions. Thank you.
New South Wales recorded 935 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. There was 1 overseas case. We had 124,650 COVID tests performed. New South Wales Health vaccinated over 23,156, but I'd like to really thank and acknowledge the key work of our GPs and our pharmacists, who have been doing an amazing job. As the Premier has indicated, we've got 20% of 12 to 15-year-olds already vaccinated, and there is increasing access to Moderna through pharmacies, which is appropriate for that age group, and also GPs have Pfizer as well. So I just can echo the Premier's call for 12 to 15-year-olds to please go forth and get vaccinated ahead of their return to school. There are currently 236 people in intensive care, 123 who require ventilation. Tragically, there were 4 deaths. A man in his 80s from Western Sydney died at Nepean Hospital. He was not vaccinated and had underlying health conditions, and his death is the second death linked to the outbreak at the Uniting Engleglaze Lodge residential aged care facility in Penrith. We have sadly the death of a woman in her 80s from Wollongong. She died at Wollongong Hospital. She had received 1 dose of the vaccine and had underlying health conditions. There was a gentleman in his 60s from southwestern Sydney who died at Liverpool Hospital. He was not vaccinated and also had underlying health conditions. We also had a gentleman in his 60s from southwestern Sydney who died at Liverpool Hospital. He also had received 1 dose of the vaccine and had underlying health conditions. So it does also call me to remind people that whilst 1 dose does afford some protection, it is critical that you come forward and get your 2nd dose in a timely manner. I want to announce that Cowra is going into a lockdown effective from 5 p.m. And anyone who was in Cowra from the 13th of September, regardless of where they are, must adhere to the stay-at-home requirements. There was a 9-year-old boy who attended school in Cowra, and there were a number of associated community exposures. The source at the moment is under investigation, and I would call on the Cowra community, which I know they will respond to increased testing. And it is pleasing to see that the Cowra population has a high vaccination coverage, but again, call out the Cowra community to go forth and get vaccinated. We've also got some concerns around Doherty because of a sewage detection, and also keeping vigilance in Kempsey. So again, if we could see those high rates of testing there. In terms of the suburbs, whilst we are seeing some pleasing declines in some of the suburbs, and clearly the numbers today reflect that, it is too soon for complacency. And so I call upon the communities of Greenacre, Guildford, Bankstown, Merrylands, Casula, Wayland, Fairfield, Maroubra, and the Wollongong and Central Coast communities, and the areas around Waterloo, Redfern and Inner City, to please be vigilant for signs and symptoms. Come forward for testing, and please take care as you go about your required activities under the public health orders. Thank you.
Thank you, Dr. Chant. Well, it's great to be here in Western Sydney today with the Premier, the Minister for Western Sydney, Stuart Ayres, and our Western Sydney MPs. We know that it has been a very difficult time for Western Sydney, particularly over the last 3 months, but today there are 5 billion reasons as to why things are going to get a whole lot better. The WestConnex transaction, which we've completed, has enabled and the West Invest Fund will deliver greater opportunity and prosperity for people right across this region. We want Western Sydney to be the best place to live, to work and play, and this West Invest Fund will ensure that happens. I want to announce that as part of the transaction today, we've received $11.1 billion, and that's on top of the $9.26 billion for the 51% share of WestConnex. As a result, the total amount the state has received is $20.4 billion for a road project we've invested $16.8 billion in. But as part of that transaction, it's enabled $5 billion in headroom that will be directed straight back into the people of Western Sydney. So whether that's going to be significant investment right across the board, more open spaces, better playgrounds and sporting grounds, better schools and pools right across the state, families right here in Western Sydney will benefit from the investment we've made today. This isn't just an investment in places, above all it's an investment in our people. We want Western Sydney to be the very best. We took on this road project when we came to office. The Labor Party opposed it. This road project has ensured that Parramatta Road flows faster. The people right across Western Sydney are able to get to Sydney faster, get home to their families as quickly as possible. It's all about livability, ensuring the public transport investment off the back of it has continued out here in Western Sydney. And this transaction will enable greater opportunity and prosperity, not just across the state, but particularly as a result of this $5 billion investment in Western Sydney today. Families right across the board will receive significant benefit as a result of the government's decision. I want to thank Sydney Transport Partners for their partnership with the New South Wales Government. I want to thank the Treasury team as well. They've worked tirelessly on this transaction. It's unlocked capital that we can invest. It's a testament to the strong financial management that we've had since coming to office, unlocking capital and investing it in further infrastructure right across the state. But particularly, this investment today will improve the livability. We want, as I said, Western Sydney to be the best place to live, to work and play. And this investment today does exactly that. The travel time saving from Penrith into the airport, 40 minutes as a result of the construction of WestConnex. From Burwood to the airport, 20 minutes, 50 sets of traffic lights, all gone away as a result of this state's investment in this road. But importantly, it's not just the investment in this infrastructure, it's the opportunity that it provides for us to make significant investments right across the board. And I'm very proud of the work that the government has done in relation to this transaction. The construction of this road, finalising the transaction today, will ensure that Western Sydney families, not just for today, but for generations to come, are better off.
Thank you, Premier, and thank you, Treasurer. We've been asking people right across Western Sydney to go and get a shot in the arm to help our communities recover from COVID, to reopen our homes, our businesses, reopen our communities to the world. Today, the New South Wales Government is delivering Western Sydney a $5 billion shot in the arm. This is exactly what Western Sydney needs as it bounces back from the impacts of COVID. There's no doubt that Western Sydney's been at the forefront of our fight against this insidious virus. It's impacted our communities more than any other community. And I want to say a huge thank you to the champions of Western Sydney that are standing behind me today. Those local MPs that have been in their communities every single day of this pandemic. They've been business counsellors, they've been mental health counsellors, they've been business advisors, they've been traffic cops directing people in the right direction. They've been health advisors. They have been there helping their communities out every single day through the course of this pandemic. They have been the strongest advocates for protecting their community, making sure their communities get the resources that they need, and they've been the strongest possible advocates for making sure that off the back of this amazing transaction, that Western Sydney is going to get the investment that it needs, not only to bounce back from COVID, but to really set up this region for New South Wales well into the future. We've learnt through the course of COVID just how important open public spaces are. It's great to see this fund going to invest in more of those. We know Western Sydney is a growing community. We know as our population continues to grow, we've got to provide high quality amenities, better quality facilities for people right across Western Sydney, and that's exactly what this fund will deliver. The West Invest Fund is about setting us up for the future. It's about enabling growth and making sure people who choose to live and raise a family and work in Western Sydney get access to the best quality facilities. Our track record as a government is quite significant when it comes to investing in major infrastructure. The road infrastructure like WestConnex, the supporting road infrastructure around the new Western Sydney Airport, the new rail lines, the new light rail. We do big infrastructure better than any other government in New South Wales history, and today's West Invest Fund will ensure that we take our track record on that big infrastructure and we deliver it in spades in community infrastructure right across Western Sydney, so Western Sydney bounce back from COVID better than anywhere else in the country.
Look, Dr. Chand and I and the team aren't ready to call it yet. We always knew that the peak would hit in around middle of September. Look, I certainly hope it's behind us, but you never know with COVID. It's insidious, and if there's too many super spreading events, we can easily go back to those 1,500 numbers that we saw a couple of weeks ago. So we're feeling more positive than we have in a couple of weeks, but we're not ready to call it. And what I do want to brace the community for is notwithstanding what happens to cases, and that's why I've said the case numbers are less relevant at this stage of the pandemic. What we need to do is really keep a close watch on how many people end up in hospital. Because we've seen the accumulation of so many cases, we know that October is going to be very challenging for our hospital system. And I don't want any of us to sit back and think the worst is behind us, because unfortunately, too many families are going to have loved ones end up in hospital or worse. And that's why we've been pushing the vaccination rate so hard. And I'm so proud and pleased that many of our communities in Western Sydney are now leading the nation in their vaccination rates, because that protects people from staying out of hospital and or worse. So whilst it's pleasing to see the consistency in the last few days of where the numbers are going, the most relevant number for us is the vaccination rate and also what's happening in our hospital system. So I just want to brace people and to make sure people realise that no matter what's happening with the case numbers, what worries us is how many people end up in hospital, and we just need to be aware that that hasn't peaked yet. That's likely to peak sometime in October, and we also have to accept that once we start reopening, cases will go through the roof, but it won't matter as much because people will be vaccinated. So our aim now, our strategy between now and when we hit 70% double dose, is to get the number of people with COVID as low as possible and vaccinated as much as possible, so that when we open up, we have perhaps, if we keep working hard, 90% of our adult population with at least one dose of the vaccine, and a good chunk of our 12 to 15-year-olds vaccinated. Now that will give us enormous confidence that we won't be overwhelmed in November and December in our hospital system. Well, obviously, the National Plan allows states to have that degree of flexibility, which is the beauty of the National Plan. So when I hear colleagues across the nation concerned about the National Plan, I think there's enormous flexibility there. And what the National Plan does is make sure that Australia opens up together. And that's a matter for other premiers. Look, I've been quite comfortable in being the first one in the nation out of the premiers to make certain statements about Delta. We've been the first ones to experience what Delta is like. We've been the first ones to charter our course out of this, and that's okay. What other premiers do is a matter for them, but our aim in New South Wales has always been to be very direct and transparent and use language and concepts that perhaps have been confronting. But it's important for our community to know exactly where we stand and what we see the next few months bringing us, but also to do so with confidence. If people stick to the rules, get vaccinated, we will open up first in the nation and live with Delta confidently and safely, and look forward to resuming those activities we've missed for a long time, including overseas travel, welcoming home Australians. All those things we've missed can be a reality in a short period of time, so long as we all keep moving forward together. Oh, look, I don't want to disclose what's discussed in National Cabinet. That's not really appropriate. But I think you've heard me be very vigilant about supply being a challenge for us, and we just want to make sure we get our hands on as many vaccines as possible. Oh, look, I'll leave that for the Commonwealth to make those announcements. I won't disclose what was discussed in National Cabinet, but I'll leave the Commonwealth to talk about those supply issues. Look, obviously a few weeks ago when we had Dr Nguyen, a wonderful advocate for clinicians in Western Sydney Nepean Hospital, give a detailed account of how the New South Wales health system has worked for 18 months to prepare for that critical mass of patients with COVID. And so part of that plan that she outlined that our experts have been working on included the system being technically overwhelmed in some weeks during October. That means when I say images of things we've not seen before, it means many additional spaces within hospitals dedicated to COVID patients in intensive care, patients perhaps having to be taken to a hospital that might be quite a distance away from where they live, and the like. So they are the type of images, the type of healthcare that we need to brace ourselves for. We are in a pandemic. The worst pressures on our hospital system are expected to be in October, and obviously we're keeping a keen eye on that. Interestingly, the number of people in our hospital system is slightly less than what we thought it would be, but the number of people in intensive care is about what we expected. So we need to be aware of that, and we need to know that come October, there will be weeks when our system will be technically overwhelmed, but the plans are in place. I want to give people the assurance that the plans are in place. They've been worked on for 18 months. But if you hear people say that this has never been done before, or this is being done differently, or see images that don't look like what we normally see, that's because we have to react like that to the pandemic. Ordinarily, we'd have 500 staffed beds in our intensive care unit across the state, For the pandemic, we have 1,550 just to demonstrate the surge capacity, but to demonstrate that the system will literally be having to work triple as hard as what it does in ordinary circumstances. And we also know that in ordinary circumstances, there are pressures on the system every day. We'd hear stories about pressure on the system even without a pandemic. So I just want people to be aware of what's coming up, just want people to be aware of what to expect, and more than ever, to thank our wonderful hospital staff who are bracing themselves, who've been training for this and preparing for this for at least 18 months, but also appreciate that because of them, we can have that assurance that everybody who needs hospital care and intensive care will receive it.
Premier, I'm assuming that with what you're saying this morning, that the permit system for essential workers in West and South West, you're not going to budge on that before you reach
Oh, look, that is the only the authorised workers list and the permit system is the only thing which differentiates any part of Greater Sydney and the restrictions. And as you appreciate, our aim is that when we open up at 70%, our case numbers are as low as they can be, so that we can therefore make sure we all move forward together. So that whether you live in Western Sydney or you live anywhere else in the Shire or anywhere else, you'll be able to visit all parts of New South Wales. And that's our aim, to be able to open together. Everybody who is fully vaccinated at 70% will get freedoms. Let me make that very clear. If you have made the effort of getting yourself vaccinated, by the time we open up at 70%, you will be able to go and eat at a cafe, you'll be able to get your hair cut, you'll be able to do all those things we've all missed. But the one issue we have is to make sure that we also provide equal mobility to everybody, and that's why our strategy, which is so far so good, but again, too early to call, is to make sure we get the case numbers as low as possible so that when we open up, everybody can move around as freely as possible, including across the regions. I'll come back to you next, sir. Yeah.
Given the low vaccine rate, or vaccination rate around Byron Bay, how concerned are you that there'll be a massive dissension on that area over Christmas and New Year, and what there could be a big explosion?
No, that's a good question. And obviously what we're doing now is proactively moving into communities and providing increased vaccination opportunities to try and get everybody together. But there are obviously pockets of resistance. We know where those pockets are. And I have faith in people to make decisions about where they think it's safe to take their family. And I just want people to acknowledge that, because unvaccinated people, it's one thing to put themselves in jeopardy, but they're jeopardising everybody else because they're more contagious. If you choose not to be vaccinated, it's one thing to make that decision for yourself and your family, but you're also making that decision suggesting that you don't care if you're more contagious to other people. And that means all of us have to be on guard, because as Dr. Chant and myself and everybody have been saying, even if you're double vaccinated and have underlying health conditions, you could still be at risk. And I worry for people like my parents or others in the community who are aged, who are fully vaccinated, but yet could still be vulnerable if COVID hits. And we have to think about that. But the most important message is I believe that families will make those important decisions for themselves as to what is safe for them to do. And no matter what rules governments or businesses put in place, at the end of the day, all of us have personal choices as to what we think is safe for us and our families. And I have complete faith that citizens will make those good choices. Sorry, you were next, Chris.
on the retail sector, they want clear guidelines on how they refuse people entry to their stores, and would people need a hard certificate to verify the vaccination if they don't have the app?
Right, so at 70%, only those who are fully vaccinated will be able to enter non-essential retail premises. And the government's already said that we're developing our own vaccine passport. So Minister Dominello, through Service New South Wales, is ensuring that when you go into a retail, say a big supercentre or a big shopping mall or a complex, there'll be a QR code, and when you use your QR code, it will also show whether or not you're vaccinated. That will all be in one step, so you won't need to have anything, a bit of paper in your pocket or anything else. You'll just be able to do it in one step. So when you check in, it will also show whether you're vaccinated, and that will be obviously as you enter a major complex, but it will also be for individual shops within a complex. What the government is now doing is working with stakeholders to make sure we give them the best advice we have on legal requirements, just as we did at previous outbreaks. Remember, previously business and government and community worked well together. Individuals have responsibility to do the right thing, as do businesses. If businesses are flagrantly disobeying the COVID rules, they don't have a QR system, or they're not checking or caring, well, obviously we'll take action. And similarly for individuals, but I've got confidence that business and community will work together to do the right thing. And we are going through that. Look, the trials are ongoing, and as soon as the federal government gives us the data, because the federal government captures or has all the information about vaccine rates, and what they do is then give us their data, and as soon as we get the federal government's data, we're able to build it into our system, and we're confident that's going to happen in early October, ready for when we open up at 70% double dose. Look, the Doherty we've been looking very closely at the Doherty Institute modelling, and we are doing everything within that model. The modelling, and I want to stress this point, the modelling gives good guidance to state governments on what to do if you have low case numbers, if you have medium case numbers, and if you have high case numbers. So that's why Dr. Chant and my colleagues and I are really keen to make sure we have as few cases as possible once we get to that 70% double dose, because then obviously you can move forward together with more confidence. And everything we've done is within the Doherty plan. It's safe, it's cautious, but it's also taking on board all the risks and benefits. We appreciate, I should say, you don't know unless you're in those circumstances, but we appreciate the pressure that families have been under, individuals have been under, and you've got to balance that up with making sure people are safe, but also that people can go back to work, go back to our lives, go back to appreciating that Delta's going to be with us, and we don't know for how long, and we need to eventually live with it. And I think the path that New South Wales has set forward is a safe one, and one which we can move forward with optimism and caution. Well, that's why we're asking everybody, all parents, to consider having their 12 to 15-year-olds vaccinated, making sure they're vaccinated, their teachers will be vaccinated. So we can't really say more now until we get closer to that time of the 25th of October. But our intention is that all children resume face-to-face learning throughout the state at the same time. Some communities already in the regions do have face-to-face learning. Some Year 12s already have face-to-face learning. But we're really keen to make that happen, and we can't predict what the virus will be doing at that stage. But what we can do is minimise the risk of cases getting out of control and people ending up in hospital. We can do that by, if we continue to stick to the rules, continue to get our communities vaccinated, it gives us the best chance of having everybody move forward together. And no doubt Dr. Chant and her team will give us that advice closer to the time. They'll give us that advice closer to the time on whether we need to make certain things in certain locations or else we can have the same rules all across the board. And then I'll go to ministerial, yep. Oh, well, look, I think families will make their own choices. But what we have made freely available to everybody is information. Every day our citizens can look up our health website, look up Service New South Wales, see what is happening with our vaccination rates, see what is happening in our hospital system, to give them good information about what they think is a safe thing for their family to do. And we'll continue to be that transparent.
When are we going to see those police fines getting rolled back? And just a general comment about the police response in Western South West Sydney now.
Well, the fines are dictated by the health orders, so it's not something that the police or I have any input in. That's a public health order that determines what's going to be fined and what offence is going to be fined and what isn't going to be fined. So you probably have to direct that to Brad Hazard. But I think, listen, the police have done a magnificent job. I think the fact that we saw threats of civil disobedience on the weekend didn't eventuate is proof that their planning is spot on, and I think the tempo is solid, and I think the community is getting the message that the police are there to enforce public health orders for their benefit.
Well, firstly, this represents great value to the people of New South Wales. We will be retiring the equivalent of $11.1 billion in debt following its distribution into the Generations Fund. The $5 billion support comes from the difference in relation to the amount that the government has spent on the WestConnex project, the proceeds that we've received in relation to both the 51% and the 49%, as well as proceeds on distributions that we've received from the Generations Fund. And that has enabled, that strong financial management has unlocked $5 billion. And I want to make the point that this is a great win for the people of Western Sydney. The recovery starts today. We know it's been a very difficult time right across our state, and last year we lost hundreds of thousands of jobs, recovered every single one of them plus more. But the silver lining of this pandemic will be, through our strong financial management and the foundations of the economy in this state, we are able to invest that capital, have a great social outcome at the end of it, but at the same time drive jobs growth and economic growth. And with this announcement today, that will occur right here in Western Sydney. Western Sydney, I mean, New South Wales are winners today, but particularly the families of Western Sydney have won big by the result of this transaction.
Is this an attempt to soften the blow of paying tolls? We know that Sydney West and South West are already under economic stress because of COVID. Could you kind of, soften the blow, the fact they're going to continue paying tolls?
Well, the transaction, Chris, the transaction doesn't impact the toll regime here in New South Wales, and we understand that no one likes paying tolls. If you're living in northwest Sydney, for example, and you're driving in to the city, you pay tolls if you choose those toll roads. But ultimately, what WestConnex has achieved for the people of Western Sydney is ensure that those other roads, those ancillary roads, flow faster. And if Labor were in government, you'd all be late to this press conference because you'd be stuck on Parramatta Road. That's just the reality. So, yeah. No, just like our Restart Fund with the Poles and Wires transaction, we've created $5 billion in headroom. That financial management has ensured that we can establish a fund to assist and improve the lives of people right across Western Sydney. We've said from the outset that we'll be launching our economic recovery plan in October. This is the first announcement today. This is the first tranche of that economic recovery, a substantial investment in Western Sydney, better open spaces, playgrounds, sporting grounds, schools and pools. We want to make sure that Western Sydney is the best place to live, to work, to run a business, raise a family. And because of our strong financial management, because of this transaction today, we've been able to set up the West Invest Fund to transform Western Sydney, not just for today, but for generations to come. The government doesn't have any plans in this space. I mean, ultimately, if you look at the asset base of the state of New South Wales, it's grown from $60 billion under Labor to close to $250 billion under the Liberals and Nationals. That's what strong financial management is. Right across the state, we've been able to invest in better schools, better hospitals, better public transport. And that's been because of our asset recycling approach. We've come into this pandemic with strong economic foundations. That didn't occur by accident, and we will continue. The government has obviously been committed to this transaction for some time, and obviously back in 2018, prior to the last election, we committed on the first tranche of that transaction, delivered $9.26 billion for the people of our state, and today's announcement of $11.1 billion, a total of $20.4 billion and $5 billion right here for Western Sydney, will ensure greater opportunity for families who live in Western Sydney, and that's a great example of the strong financial management. Sorry, I missed that. Absolutely. No, this transaction does not have any effect on tolls. Despite what Labor will say, the reality is they are against WestConnex from the start. They opposed the construction of WestConnex, and now we have families getting home faster as a result of that decision to take our state forward. Let's not forget, this all goes back to the dying days of the Labor government, where they would not invest in infrastructure. It was all put in the too hard basket. We took that challenge on. We want the best for people right across the state. We made those investments, and today you can see the fruits of those decisions. Not only do we have a road that has no debt associated with it, we have a $5 billion investment right here in Western Sydney that's going to improve livability. The toll regime is not affected at all by this by this transaction today.
Would it be preferable not to
Sorry,
have
Chris.
one
So Chris,
Why is it a better deal with not retaining the road and
we're able to pay down $11 billion in debt. That's a great, that's incredibly important for the people of our state. And on the back of that, we're able to invest $5 billion right here in Western Sydney. That has been our asset recycling approach from the start. As I said, the Labor alternative is to not build the roads, to not build the public transport, to not have the public spaces, the open spaces, the playgrounds that make our state so great. That's the difference. The difference between the Liberals and Nationals is we're taking our state forward. Whereas Labor sit on their hands, complain and oppose. They probably, got a kickback from the car yards on Parramatta Road back in those days because they love people sitting there in traffic. We now have our road network moving faster. We have better livable communities right across the state. $108 billion of infrastructure investment over the next 4 years. That's record amount in schools, record amount in hospitals and public transport. That is the Liberals and Nationals way. And under the Berejiklian government, that's exactly what we've achieved. We aren't going to stop. We're going to continue to take our state forward, and I think today is a massive win for the people of Western Sydney. We'll work through those issues as they come through, but we're completely committed to our asset recycling approach, which is unlock capital to build further infrastructure. Roads like WestConnex would not have been built without that approach. The announcement we're making today, a $5 billion investment, would not be possible but for the approach we've taken. And we've always said when it comes to WestConnex, we've been committed to the transaction. It's always been the government's position in relation to that. And we know that asset recycling has been enormously successful. That infrastructure investment hasn't just created better schools and hospitals, it's also laid strong economic foundations and jobs growth as we move through it. And the investment today in Western Sydney will see thousands of jobs created, from Canterbury, Bankstown and Burwood in the east to Wallandilly in the Blue Mountains in the west. The Western Sydney economy will boom as a result of this investment, and as will the amenity and the public spaces, playgrounds and open spaces off the back of it. So this is a win-win-win. Well, what I'm not going to get into is a discussion on hypotheticals. We've just completed this transaction. The government has no plans in relation to further asset recycling. What we've said today is that this transaction, which we've always been committed to, has ensured a substantial, successful and strong result for the people of our state. It's not the government's money, it's the taxpayers of New South Wales, and every single family across New South Wales benefits from this decision today. And to be here with my Western Sydney colleagues, strong advocates for their electorates, for their local communities, know all too well the benefit that $5 billion will have for the people right across the region.
Why must it always be transferred? Isn't it a preference for one entity not to have a closed-door monopoly for business rollout?
Well, what's most important for us is the outcome, Chris, and the significant return the people of New South Wales have received today will provide a real difference to people's lives. And we only complete transactions if we believe that they are in the best interest of the people of our state. And we set a reserve price. It was well exceeded by the offer that came through in relation to the 49% share. And this is a great deal for the people of our state. It's been the approach we've had in the past. And I think we can see the dividends. And when you're driving back into the city today and you're driving along WestConnex, just think how difficult and challenging it would be in circumstances where that road would not exist. Well, we obviously had other bids, and prior to close, we set a reserve price for the state based on our analysts' advice. And at close, there was one consortium in Sydney Transport Partners, but the bid that they made well exceeded the reserve price for the state. Yeah, it's a real challenge. I mean, obviously, Sydney is a global city, and global cities, housing affordability will always be a challenge. I know that Minister Stokes is doing significant reforms in that space to continue to unlock supply, to drive further housing across New South Wales. And in addition to that, we are doing a significant amount in support for first home buyers to help them get in the market with our stamp duty concessions. But look, these are always challenges facing major cities right across the globe, and Sydney is no different to that. And we'll continue to look at ways to unlock supply, to build more homes, and that's like the investment we're making today. Obviously, one aspect is housing affordability. We also want to invest in livability and having great parks, having great sporting grounds, and that's exactly what this investment today will deliver for the people of Western Sydney.
Thanks, everyone.
Thank you.
Good. I'll let Gloria now.
Thank
That's all
you.
there.
Thank